Hello, everyone. Thank you for joining tonight's webinar. A few housekeeping notes before we dive in. Please note that everyone is muted upon arrival to allow our presenters to share undisrupted. That said, we would love to hear from you. If you have a question, please type it into the Q&A box. Select audience questions will be answered in that box, but several will also be answered directly from our experts at the end of this session. Please note this meeting is being recorded and will be available to view on demand later this month. To make sure you are alerted when this is posted, be sure to follow Elsevier Student Life on Facebook. We have a fantastic presentation planned for you this evening. Tonight's presenters will be leading a question and answer based review session around pharmacology, where you will practice answering test questions, then review rationales and strategies. The authors of our best-selling NCLEX-prep books will also be sharing a few smart study recommendations to help you prepare for the NCLEX. To get the most out of this session, we recommend you are viewing in full screen and prepared to answer the NCLEX questions that will be delivered via polls throughout the presentation. If you have an issue seeing the polls, we recommend you check your computer's pop-up blockers to make sure there is nothing hindering this presentation. Without further ado, I'd like to turn it over to tonight's presenters, Elsevier authors and NCLEX gurus, Linda and Angela Silvestri.
Thank you, Abby. Well, welcome everyone. It is so great to have you all joining us tonight. And it looks like there are well over 1,400 participants joining us this evening, so that is fantastic. We are so excited to have the opportunity to present to you tonight on preparing for those pharmacology questions on NCLEX. My name is Dr. Linda Ann Silvestri, and I am presenting with Dr. Angela Silvestri. And together we will review some strategies and tips to help you best answer those pharmacology questions. Okay, on this next slide, let's take a look at the agenda. In tonight's session, we will practice answering pharmacology test questions, and we will review rationales and test-taking strategies. We have selected practice questions based on what we know about the medications that you will most likely be asked on NCLEX. And we also want to remind you to review the list of the top 100 prescribed medications in the United States that is located on the last page of the comprehensive review books, and be sure to be familiar with these medications. Also, the other thing we would like to do is remind you of our Q&A session next week on 6/2. And at that session, we're thrilled to be able to have an RN and a PN recent graduate who took the NCLEX, and they'll be able to answer your questions also. Now, if you look at the RN test plan and the PN test plan side by side, you would not note many differences. Most differences relate to intravenous therapies and some management roles. And as far as pharmacology, the NCLEX test plan dedicates 12 to 18% of questions on pharm and intravenous therapies for the RN exam, and 10 to 16% for the PN exam. We're going to review some general medication guidelines to follow when answering medication questions, and we'll review some smart study recommendations to demonstrate proven methods to prepare you for these questions. Angela is then going to show you how to navigate through Evolve to best access the pharmacology practice questions. Okay. So on this slide here, we have some general medication guidelines, and we'd like to review these with you. So the first one, medication absorption, distribution, metabolism, and excretion are affected by age and physiological processes. So the older client and the neonate and infant are at greater risk of toxicity than an adult is. And this is a really important point. If there is an age specified in a question, be sure that you pay attention to the age and think about physiological processes related to growth and development and aging. And also think about your maternity client And remember that many medications are contraindicated in pregnancy and with breastfeeding. So if a pharmacology question presents a maternity or breastfeeding client, one of the first things that you need to do is check to be sure the medication is not contraindicated. So look to see if there is an option that relates to such, because that would be your priority and your first action. Okay, now antacids are not usually administered with medication because the antacid will affect the absorption of the med. So don't select the option that indicates giving the client an antacid with the medication or within 2 hours of the med administration. Grapefruit juice is not usually administered with medication because it contains a substance that will impede the absorption of the med. So don't select grapefruit juice as an option if the question asks what you should give when administering a medication. Your enteric-coated and sustained-release tablets should not be crushed. Also, capsules should not be opened. So if you have a question about a client who has difficulty swallowing, remember your best plan of action is to see if you can obtain a liquid form of the med. If not, you can consult with the pharmacy about an appropriate form of action as far as crushing tablets or opening capsules. Okay, on this next slide, we have a few more guidelines, and then we will practice some questions. Your nursing interventions, they always include monitoring for intended effects, side effects, adverse effects, or toxic effects of the medication. So focus on what the question is asking about. Is it an intended effect, a side effect, an adverse effect, or a toxic effect? It's going to make a difference in how you answer the question. Let's just quickly review these effects. Now, an intended effect is the therapeutic effect. It's what you want to happen. So for example, the intended effect of an antihypertensive is to lower the blood pressure. Now, a side effect is one that can occur from a medication. It's not directly harmful, and it can usually be prevented. So for example, if you know that codeine can cause constipation, then stool softeners are important, as well as teaching the client about the importance of fluids and a high fiber diet. So again, a side effect is not directly harmful. It is more annoying than anything else. And another example is with your ACE inhibitors. Cough is an annoying side effect. It is not harmful, but sometimes annoying enough to the point in which the physician needs to change the med to a different one. Now, your adverse and toxic effects are very much unwanted and can be life-threatening. So for an example, an adverse effect can be an allergic response to a medication. So you would immediately stop or withhold the medication and report the event. A toxic effect produces signs and symptoms, but is also monitored via a laboratory test. So for example, in digoxin toxicity, the client may experience gastrointestinal disturbances such as anorexia, nausea, vomiting, or visual disturbances. And this would alert you as the nurse of a problem. Laboratory results will show that the digoxin blood level is greater than 2 in conventional units. The nurse or client should never adjust or change a medication dose, abruptly stop taking the medication, or discontinue a medication. So you would never teach a client to stop the medication. Now, the nurse may withhold a med if he or she suspects that the client is experiencing an adverse or toxic effect of a medication, but then the nurse must immediately contact the physician if either of these effects occur. So for example, you note signs of digoxin toxicity in your patient that is due for a dose of dig. You would withhold the medication until you did a further assessment and determined the cause of the client's symptoms. The nurse may also withhold the medication if specific parameters are prescribed and withholding the medication is indicated based on these parameters. So for example, the physician may write, hold metoprolol, which is a beta blocker, for a systolic blood pressure below 90 mmHg. The client needs to avoid consuming alcohol and to avoid smoking. So there's no smoking or the use of alcohol when you're answering test questions. Don't be tempted to select an option that reads, the client can have 1 ounce of alcohol daily, or the client can smoke 1 cigarette a day. Remember, no smoking or alcohol on any exam, so you don't want to select those options. Learn generic names. Trade names are not generally going to be seen on NCLEX. So for example, you will not see the name Lasix, but you will see the generic name furosemide. So during nursing school and in preparation for NCLEX, be sure to learn these generic names. On the next slide, we have a question on the non-opioid analgesic acetaminophen, and I'm going to turn this over to Angela.
Wonderful. Thank you, Linda, for that overview. And I'm very happy to be presenting to you guys tonight on this really important topic. And so without further ado, let's go ahead and dive in and work on our first practice question. An emergency department nurse prepares to plan care for a child diagnosed with acetaminophen overdose. The nurse reviews the primary healthcare provider's prescriptions and prepares to administer which medication? 1, Succimer, 2, vitamin K, 3, acetylcysteine, and 4, protamine sulfate. Wonderful. So it looks like 82% of you all chose the correct answer, which is option 3, acetylcysteine. So let's take a closer look at this. So acetaminophen is better known as Tylenol. Acetylcysteine is the antidote for acetaminophen overdose. It's administered orally or via nasogastric tube in a diluted form with water, juice, or soda. And it can also be administered intravenously in some form as well. So to answer these types of questions, it's important to know the antidotes to some common medications, with acetaminophen being one of those. Others may include warfarin or heparin. Succimer happens to be the treatment for lead poisoning, and so that's not the correct option. Vitamin K is the antidote for warfarin, and protamine sulfate is the antidote for heparin. Another important point that you should remember about acetaminophen is that it's hepatotoxic, and so it should not be used in a client with liver disorder. On the next slide, we can go over a question on the beta blocker carvedilol. The nurse is assessing a client who's being treated with carvedilol. Which assessment findings would indicate that the client may be experiencing dose-related side effects of the medication? Select all that apply. 1, dizziness, 2, chest pain, 3, bradycardia, 4, reflex tachycardia, 5, sexual dysfunction, and 6, cardiac dysrhythmias. All right, so it looks like we're kind of all over the board on this one. So let's take a closer look. The correct options are going to be, options 1, dizziness, 3, bradycardia, and 5, sexual dysfunction. And so let's look a little bit closer. Carvedilol, also known as Coreg, is a commonly used beta adrenergic blocker, and these are also commonly called beta blockers. They're useful in treating cardiac dysrhythmias, mild hypertension, mild tachycardia, and angina pectoris. Side effects commonly associated with beta blockers are usually dose-related and include dizziness because of the hypotensive effect. And they also include hypotension, bradycardia, and sexual dysfunction or impotence. So if you look at options 2, 4, and 6, these are actually reasons for prescribing a beta blocker. And so they're intended effects. And if you recall what Linda was mentioning before, you want to focus on what the question is asking. And in this case, it's asking for a side effect. Another strategy to note is the name of the medication. The name of this medication ends in LOL. And so when you see these letters in a medication name, you should think that it's a beta blocker. And then again, note the subject and note that it's asking about a side effect, not an intended effect, not an adverse, and not a toxic effect. And that will help you to answer the question correctly. And then moving on to the next slide, we have a question on the antiplatelet clopidogrel. A client shares with the nurse that he needs dental surgery, but the client's dentist does not feel comfortable doing the surgery because the client takes clopidogrel every day. Which response would the nurse make to the client? 1, you should probably change dentists. 2, that's a question for your pharmacist. 3, there's no risk to having such a minor surgery while taking clopidogrel. And 4, the surgery can safely be done 7 to 10 days after the medication is withheld. All right, nice work on that. So 95% of you guys chose the correct answer, which is option 4. Clopidogrel is also known as Plavix. It's an antiplatelet and it affects the platelet for its life, which is 7 to 10 days. And so for any elective procedures such as dental surgery, antiplatelet therapy should be withheld for approximately 10 days before the surgery to prevent any bleeding complications. So the client will need to consult with their prescriber of the clopidogrel in this case. And also for this question, you should remember the use of therapeutic communication techniques to assist in eliminating incorrect options. You can eliminate options 1 and 2 because they're non-therapeutic and they place the client's concerns on hold. And then remember to always address the client's concerns in an accurate manner. All right, so on the next slide, we have a question on the selective serotonin reuptake inhibitor, ESCITALOPRAM. The nurse is providing instructions to the client prescribed ESCITALOPRAM. The nurse would appropriately provide which instruction to the client? 1, avoid skipping doses. 2, limit the use of alcohol. 3, increased suicidal ideation is expected. And 4, initial worsening of depression is expected. All right, so you guys did pretty good with that one. 67% of you chose the correct answer, which is option number 1, avoid skipping doses. So escitalopram, it's also known as Lexapro, is classified, as I mentioned, as an SSRI, and it acts by producing an antidepressant effect. Instructions for the client taking this medication should include avoiding skipping doses or altering the dosage of the medication in any way. You also want to avoid the use of alcohol, not limit the use. And remember, there's no alcohol on NCLEX. And then reporting increased suicidal ideation or worsening of depression immediately to the prescriber of the medication is really important. Recalling that alcohol is never encouraged will assist in eliminating option 2. And then you can eliminate options 3 and 4 because they're comparable or alike, and they both relate to the mood disorder. All right, so moving on to the next slide, we have a question on a potassium wasting diuretic, furosemide. A client experiencing difficulty breathing and increased pulmonary congestion was prescribed furosemide 40 milligrams to be given intravenously. After 1 hour, which assessment value indicates that the therapy has been effective? 1, the lungs are clear upon auscultation. 2, the urine output has increased by 400 milliliters. 3, the blood pressure has decreased from 118/64 to 106/62. And 4, the serum potassium has decreased from 4.7 milliequivalents to 4.1 milliequivalents in conventional units. All right, so 71% chose the correct option, which is option number 1. The lungs are clear upon auscultation. So furosemide is the generic name for Lasix, and it's a potassium wasting diuretic. In this situation, furosemide was given because the client was experiencing difficulty breathing and increased pulmonary congestion. So although all of the notations in the options may occur, option 1 is the reason that the furosemide was administered. Remember that when a diuretic is administered, urine output will increase. Also remember that the blood pressure will drop as a result of fluid loss. And with furosemide, it's very important to remember that the potassium level can drop because this medication is a potassium wasting diuretic. However, even though the potassium level dropped, it is still within the normal range of 3.5 to 5 milliequivalents per liter. And so these are all important points about the medication, but what you need to do is focus on the data in the question, note the word effective, and note the relationship between the words pulmonary congestion in the question and the correct option. And then on the next slide, we will go over a question on an anti-seizure medication, phenytoin. The nurse is caring for a client diagnosed with a seizure disorder who's receiving phenytoin 100 milligrams 3 times daily. Which finding indicates to the nurse that the client's experiencing a side effect of the medication? 1, constipation. 2, bleeding gums. 3, difficulty swallowing. And 4, brown appearing urine. All right, so kind of split on this one. 36% of you chose the correct option, which is option number 2, bleeding gums. So let's take a closer look at this. So phenytoin, also known as Dilantin, as I mentioned, is an anti-seizure medication. So if you did not know this, what you can do is focus on the data in the question and note that the client has a seizure disorder, so a diagnosis is mentioned here. If there is a diagnosis in any pharmacology question, this can help you to determine what the medication is if you didn't know. Note that the question is asking about a side effect. Phenytoin has some side effects, and these include drowsiness, dizziness, irritability, headache, restlessness, joint aches, and some gastrointestinal effects such as anorexia, nausea, and gastric distress. But a very important side effect specific to phenytoin that you are likely to be asked about is that it causes gingival hyperplasia. Gingival hyperplasia causes bleeding, tenderness, or swelling of the gums. And so be sure to remember this about this particular medication. Constipation and difficulty swallowing are not side effects of this medication and are not associated with this medication. Sometimes the urine may appear pink, red, or a red-brown color while they're taking this med, but this is a usual occurrence and not necessarily a side effect of the medication. All right, so moving on to the next slide, we have a question on an oral hypoglycemic medication called metformin. The nurse is monitoring a client taking metformin. Which assessment finding requires immediate notification of the primary healthcare provider? 1, diarrhea. 2, hyperventilation. 3, abdominal bloating. And 4, unpleasant metallic taste. All right, so 62% chose the correct answer, which is option number 2, hyperventilation. So metformin, also known as glucophage, is classified as an oral hypoglycemic, and it acts by improving glycemic control in diabetes. A serious and potentially fatal complication of this medication is lactic acidosis, which could be manifested by hyperventilation, myalgia, malaise, and drowsiness. This condition could advance to cardiovascular collapse, causing shock, acute heart failure, acute myocardial infarction, and prerenal azotemia if it's not recognized and treated immediately. Diarrhea, abdominal bloating, and unpleasant metallic taste are side effects associated with this medication. But again, looking at the question and noting the words immediate notification of the primary healthcare provider could help you to clue you into what you're looking for as an answer, which would be one that identifies a serious concern or an adverse effect. You can also use the ABCs, airway, breathing, and circulation, to help you answer this question. And remember that lactic acidosis is a concern with this medication, and that hyperventilation is a manifestation of lactic acidosis. All right, so moving on, we have a question on insulin. The nurse is providing medication information on insulin therapy to a client diagnosed with gestational diabetes. What information about the change in insulin needs during the second and third trimesters of pregnancy will the nurse discuss? 1, an increase in insulin needs. 2, a stabilization in glucose levels. 3, a decrease in number of injections. Or 4, a need for both short and long-term insulin therapies. All right, excellent job, you guys. 60% of you chose the correct answer, which is going to be option number 1, an increase in insulin needs. Insulin needs increase in the second and third trimesters of pregnancy. And so questions on insulin in the pregnant client will focus on this point. Because of this increased need, insulin dosages must be adjusted to balance changes in caloric intake and other factors that can increase insulin needs. So the remaining options in this question are incorrect. A stabilization in glucose levels will be accomplished by monitoring and by treatment, and there will not likely be a decrease in the number of insulin injections, and the pregnant client will be treated with short-term insulin such as regular insulin, not a long-term insulin. And remember that factors that increase stress on the body, such as pregnancy, result in increased glucose metabolism and increased insulin needs. On the next slide, we're going to go over a question on the corticosteroid prednisone. The nurse prepares to provide instructions to a client who has received a long-term prescription for prednisone. Which instruction would the nurse include? 1, take the medication at night in order to enhance sleep. 2, sometimes a sore throat may be felt, but this is not a concern. 3, the medication should not be stopped abruptly because withdrawal symptoms can occur. And 4, sudden weight gain is normal with this medication and does not need to be reported unless it becomes extremely bothersome. All right, excellent. 89% of you guys chose the correct option, which is going to be option number 3. The medication should not be stopped abruptly because withdrawal symptoms can occur. Prednisone, it's a corticosteroid, and it inhibits the body's inflammatory response. Most of the corticosteroids' names end in the letters S-O-N-E, and so this is one way to recognize that it's a corticosteroid. Withdrawal symptoms can occur if the medication was given in high doses or is abruptly discontinued. The client needs to be weaned off, especially if the medication was taken on a long-term basis or if it was a really high dose. The nurse should teach the client to take this medication early in the morning in order to mimic the body's natural burst of corticosteroid. And so morning is the best time. Additionally, the medication can cause insomnia and therefore it shouldn't be taken at nighttime. A sore throat and sudden weight gain are adverse effects associated with the use of this medication, and these things should be reported to the healthcare provider immediately. A few other points to remember about prednisone is that it can cause elevated glucose levels as well as hypokalemia. And so the client with diabetes will need to be closely monitored, and adjustments in insulin may need to be made while the client's taking this medication. And then somebody who's at risk for hypokalemia, such as a client taking a potassium wasting diuretic like furosemide, will need to have potassium levels monitored closely and may need to have their potassium replaced accordingly. All right, and so on the next slide, we have a question on the antilipemic atorvastatin, and I'll go ahead and turn it over to Linda to work on this question with you.
Thank you, Angela. Okay, which adverse effect should the nurse instruct the client prescribed atorvastatin to report immediately to the primary healthcare provider? 1, tiredness and fatigue. 2, flushing and redness. 3, muscle pain and weakness. And 4, flatulence and constipation. Great, you did great on this. 72% of you selected option 3, and option 3 is the correct answer. So let's just take a quick look at this. Atorvastatin is an antilipemic med, so that's what you want to remember first. And if you did not know what this medication is, look at the name of it and note the letters S-T-A-T-I-N, statin, at the end of the medication name. This is one way to identify the medication and what it is. Now, the statin medications can injure muscle tissue. This can progress to serious muscle injury and actually muscle disintegration and possibly even renal failure. So muscle pain and muscle weakness is very important to report. And noting the words report immediately to the primary healthcare provider in the question should alert you to the fact that the question is asking about a serious concern or an adverse effect. Now, flatulence and constipation are expected side effects of this medication. And options 1 and 2, well, they're not related to atorvastatin therapy at all. So on the next slide, we have a question on the anticoagulant warfarin. A client being discharged from the hospital will be taking warfarin sodium at home on a daily basis. The nurse has provided instructions to the client about the medication and determines that further teaching is needed if the client makes which statement? 1, I need to have a prothrombin time checked in 2 weeks. 2, I need to increase the intake of foods high in vitamin K in my diet. 3, this medication thins my blood and allows me to clot more slowly. And 4, if I notice any increased bleeding or bruising, I need to call my doctor. Okay, so looks like 90% of you selected option 2. So that is great. And we do have a few responses with the other options, but let's take a quick look at this. Warfarin is also known as Coumadin, and that is an oral anticoagulant that is used mainly to prevent thrombotic events such as thrombophlebitis, pulmonary embolism, and embolism formation that can be caused by atrial fib or other disorders. Now, oral anticoagulants prolong the clotting time, and they are monitored by the prothrombin time and the International Normalized Ratio, also known as the INR. Client education should include signs and symptoms of the adverse effects, primarily bleeding, and dietary limitations, such as limiting foods high in vitamin K as prescribed, because foods high in vitamin K increase those clotting times. Some of these foods include leafy green vegetables, liver, cheese, and egg yolks. Those are a few of them. So with this question, you need to be sure to note the strategic words, further teaching is needed, because these words indicate a negative event query, and they ask you to select an option that is an incorrect statement. Recalling that warfarin is an anticoagulant will assist you in eliminating options 1, 3, and 4. And also remembering the role that vitamin K plays in the clotting mechanism will further direct you to the option that indicates the need for further teaching. Okay, on the next slide, we have a question on the opioid analgesic morphine. A client is receiving morphine sulfate via a patient-controlled analgesic pump. What would the nurse check initially when assessing the client? 1, the PCA pump, 2, the temperature, 3, the urine output, and 4, the respiratory status. Excellent. 99% of you selected option 4, and option 4 is the correct answer. Yeah, and sometimes it's a little difficult with this, and I understand why some of you want to go to PCA pump. But what you need to remember is that morphine sulfate depresses respirations, and that's the key point to remember about any question about morphine. Test questions are going to focus around that point. So the nurse monitors the respiratory status of the client receiving morphine closely. And note the strategic word initially in the question. Also use the ABCs, airway, breathing, and circulation to guide you to the correct option. And although options 1, 2, and 3 may be a part of the assessment, option 4 identifies the priority and thus is the initial nursing action. Okay, on the next slide, we have a question on the antimicrobial amoxicillin. The nurse is caring for a client diagnosed with a genitourinary tract infection who is receiving amoxicillin 500 milligrams every 8 hours. Which sign or symptom would indicate to the nurse that the client is experiencing an adverse effect related to the medication? 1, nausea, 2, headache, 3, hypertension, and 4, watery diarrhea. Okay, so we have 51% who selected option 4, and option 4 is the answer to this question. And then we also have other participants who have selected options 1, 2, and 3. So let's take a look at this. Now, amoxicillin is an antimicrobial, more commonly known as an antibiotic, and adverse effects include superinfection, such as potentially fatal antibiotic-associated colitis. So that's important to remember because that results from the altered bacterial balance in the intestines. Signs and symptoms include abdominal cramps, severe watery diarrhea, and fever. Side effects of the medication include some gastrointestinal disturbances such as mild diarrhea, nausea, and vomiting, and headache, and oral or vaginal candidiasis. Now, hypertension is not associated with the use of this medication. Now, note that this question is asking you for an adverse effect. And recall that antibiotics have a tendency to produce severe gastrointestinal disturbances. So noting the word watery in option 4 will assist you in identifying that this option is a severe manifestation that may result in fatal antibiotic-associated colitis. Okay, on the next slide, We have a question on the bronchodilator albuterol, and I'm going to turn this presentation over to Angela.
Perfect, thank you so much. All right, a client with chronic asthma has been prescribed albuterol. The nurse is reviewing the client's medication regimen and would notify the prescriber that the client is also taking which medication. 1, trazodone, 2, prednisone, 3, gemfibrozil, or 4, betaxolol hydrochloride. All right, so it looks like we're kind of across the board on this one. Looks like 10% of you chose trazodone, 43% prednisone, 10% gemfibrozil, and 37% betaxolol. So let's take a closer look. The correct answer is actually going to be option 4, betaxolol. So albuterol is a bronchodilator. It acts by relieving bronchospasm and by reducing airway resistance. Medication interactions can occur with certain medications, and in particular with beta blockers, because they antagonize the effects of the medication. Trazodone is an antidepressant. Prednisone is a corticosteroid. Gemfibrozil is actually used to treat hyperlipidemia and hypertriglyceridemia. These particular medications do not cause interactions for the client taking albuterol. And then just a few other points as far as medications that can cause interactions that you may be asked about include digoxin because of the risk of dysrhythmias, monoamine oxidase inhibitors or MAOIs, and tricyclic antidepressants because these potentiate cardiovascular effects, and then thyroid hormones because of the increased effect of the medication. So those are just some points to remember. And then on the next slide, we have another question on an antimicrobial, and we're going to look at ketoconazole. A client has a prescription for ketoconazole. Which instruction would the nurse teach the client to follow while taking this medication? 1, avoid exposure to sunlight. 2, limit alcohol to 2 ounces per day. 3, take the medication with an antacid. And 4, take the medication on an empty stomach. All right, very good. 74% of you guys chose option 1, avoid exposure to sunlight, which is the correct option. And I'm glad to see that you're really applying the general guidelines very well that we went over with you earlier in this presentation. And you didn't choose to limit alcohol, and you didn't choose to take the medication with an antacid, so that's excellent. Ketoconazole, as I mentioned, is an antimicrobial, and it's actually further classified as an antifungal medication. The client taking this medication should avoid exposure to sunlight because it can increase photosensitivity. This is an important point to remember about antimicrobials in general. And again, no alcohol on any nursing exam or on the NCLEX. And in addition, the client needs to be instructed to avoid the concurrent use of alcohol because this medication is hepatotoxic. Antacids should also be avoided for 2 hours after the medication is taken because in this case, gastric acid is needed to activate the medication. And then this medication should be taken with food to prevent gastrointestinal disturbances, and kind of in general, medications can be taken with food to prevent GI disturbance unless it's specifically stated to take it on an empty stomach. So again, use general guidelines related to medication administration to eliminate taking the medication with some alcohol and to take it with an antacid. And then from the remaining options, it's necessary to know that the medication causes photosensitivity and can be taken with food. On the next slide, we have a question on the sedative hypnotic zolpidem. A home care nurse is providing instructions to a client who's prescribed zolpidem for insomnia. To produce maximum effectiveness of the medication, what instruction would the nurse provide the client regarding how the medication should be taken? 1, with milk or an antacid. 2, at bedtime with a snack. 3, following the evening meal. Or 4, with a full glass of water on an empty stomach. All right, this is interesting. So it looks like 24% of participants chose the correct option, which is option number 4, with a full glass of water on an empty stomach. And actually, the majority of you guys wanted to go with option 2, with snack at bedtime. So let's look a little bit closer here at this. So again, zolpidem is a sedative medication. The client should be instructed to take the medication at bedtime and to swallow the medication with a full glass of water. For faster onset of sleep, they should be instructed not to administer the medication with milk or food or immediately following a meal. And antacids, as we know at this point, should be avoided with the administration of the medication because of the interactive effects. So what you guys want to focus on here is the word maximum, and then also the strategic word effectiveness. For maximal effectiveness of medications, medications should be taken on an empty stomach with water only. And then also, you can note that the incorrect options are comparable or alike, and they all indicate taking the medication with food or with another substance. All right, so moving on to the next slide, we have a question about the psychotropic medication fluoxetine. The nurse provides medication instructions to a client prescribed fluoxetine hydrochloride. Which statements by the client indicate a need for further teaching? Select all that apply. 1, the sexual dysfunction should be a passing symptom. 2, I know that there are no side effects with this medication. 3, I know that it will take some time before I feel normal again. 4, I should be feeling much better after taking this medication for 3 days. And 5, I will need to have liver and kidney blood tests done to check for changes. All right, so the correct answer to this question is going to be option 1. The sexual dysfunction should be a passing symptom, and 59% of you chose that one. And then option 2, I know that there are no side effects with this medication, and it looks like 83% of you guys chose that, so that's great. And then option 4, I should be feeling much better after taking this medication for 3 days, and it looks like 74% of you guys chose that, so that's very good. Fluoxetine is also known as Prozac, and it's an SSRI. So the first thing that you want to do to answer this question is look at the strategic words need for further teaching. These words indicate a negative event query. They ask you to select options that identify statements made by the client that are of concern to the nurse. Remember that sexual dysfunction is a common side effect of antidepressants, and it's not a passing symptom. It's one of the reasons many people do not adhere to their treatment regimen. Next, recall that side effects can be expected to some degree with any medication. And then another important point to remember with any antidepressant is that the lag time from the time the medication is started until therapeutic effects are achieved is anywhere from 2 to 4 weeks or potentially longer. All right, so moving on now, Linda and I just wanted to share with you some more information about the various resources that we have for you. And so I'll go ahead and turn it over to Linda to give you some more information on these.
Yes, on this slide, we want to very briefly share with you some resources that will be helpful while you are in nursing school and preparing for those nursing exams. and in preparation for the NCLEX. Then Angela is going to demonstrate how to navigate through the Evolve site to get to those pharmacology questions. But first, we are excited to tell you that at the end of this presentation, you will receive a promotional page that provides a 25% discount for any of these resources and for other selected pharmacology books. So on the top left of the screen is the strategies book, and this is a fantastic resource that provides you with all of the specific strategies for answering test questions. In fact, in this book, there is a specific chapter that focuses just on pharmacology tips and strategies. In this book, there are over 1,200 questions for you to practice using all the strategies, and about 115 of them are pharmacology questions. Then you can see the comprehensive review for the NCLEX RN just to the right of the strategies book, and the PN version is just below it. Excuse me. These books serve a dual purpose and are great resources while you are in nursing school and, of course, preparing for NCLEX. These books contain both content and thousands of practice questions. And you can select practice questions based on what you are learning in school, such as maternity or pediatrics, or mental health, pharmacology, or any adult health system. And the RN book has over 1,000 pharmacology questions, and the PN book well over 700 pharmacology questions. So there's lots of practice. And the next resource for the RN and the PN is the Q&A review book. And these books contain all practice questions. So that's the difference between that and the comp review. And the questions in the Q&A book are different from the questions in the comp review books. They're higher level questions, and they really challenge your clinical judgment abilities. So as with the comp review book, you can select pharm questions based on body systems, and there are well over 700 pharmacology questions in the RN and in the PN Q&A books. And again, they're different from the comp review. And then there's the online review, which is designed based on the NCLEX test plan. And there are module content reviews, lots of practice tests, video lectures, self-check questions, and much, much more. So this is a great NCLEX prep tool for crossing that finish line. And again, it follows the actual test plan. And on this next slide, we have some SMART study approaches. So I'm going to turn this back over to Angela.
Thank you so much. So some recommendations that we have for you guys. The first one is that you access the NCSBN website and download your RN or your PN test plan and use the test plan as a study guide. It actually lists all of the nursing activities that you'll be tested on, and the website has many valuable resources for NCLEX candidates, and so we highly recommend visiting this site. And the next thing is that practicing test questions is the key to success. We recommend that you practice 3,500 to 4,000 questions before taking the NCLEX, and want to stress the importance of reading rationales and strategies for every question. We also recommend starting with using the study mode in Evolve, which I'm going to show you in just a minute, because this mode will provide you an immediate answer, rationale, and test taking strategy after you submit your selected answer. And then once you've mastered the content, you can move on to exam modes. And so I'll show you this now. I'm going to go ahead and just share my screen, and I will pull it up here. Okay. And so once you find your particular resource, so I'll show you the NCLEX RN. And then you go to student resources, exam review. And so here's the important part that you guys want to focus on. And you can use these SMART study approaches in Evolve to target your review depending on which medication classifications you're studying. The comp review for the RN and the PN, and the Q&A review for both the NCLEX RN and PN have these capabilities. And so if we go in here, and we can go to study mode, and then there's also exam mode. So study mode will give you practice questions with instant feedback, And then exam mode will give you the result and the ability to review and the feedback after you complete either a 10, 25, 50, or 100 question exam in that respective area. And so let's take a look at how to navigate. So if we were to do study mode, and then we would go to content area. And if you were to just, and quickly let me point out the new questions only function here. This is something that you always want to have turned on, so that way you're not getting repeat questions. But I'm just going to turn it off only because I've been in here a lot, and so I've been through a lot of the questions already in my view. You can choose just pharmacology and it will give you questions pretty much in any area. You can also, if you click on the drop down, you could choose by body system, so like endocrine, for example, and it will give you a mix of questions in endocrine. But then if you wanted to go specifically by medication classification, and let's say you had an exam coming up on anticoagulants, you would get questions on that. Antidysrhythmics, you could get questions on that, and diuretics, just as an example. And you can see it will pull questions specific to the classification, which I think is very helpful for when you are wanting to practice questions specific to what's going to be on your exams in nursing school. And so, so with that, we want to say thank you. We want to say stay positive and believe in yourself. You can do this. And we want to thank you so much for spending time with us this evening as you're getting ready to pass the NCLEX, take your nursing exams, whatever the case may be. We hope that you all stay safe and that you have a great night. And we would like to open it up for questions at this time, and we're happy to answer any questions that you may have.
Awesome. So I do have a few questions here for you, Linda and Angela. The first question, the student asks, do you have any tips on how to recognize the class a medication belongs to?
Yes, sure. Well, the first thing that you want to do is to read the question and note if there's a diagnosis in the question. If so, this is going to give you an indication of what class the medication is in. So for example, if the question read, a client with heart failure is receiving furosemide, then think about the pathophysiology of heart failure and that furosemide would most likely be a diuretic. Or if the question read, a client with breast cancer is receiving cyclophosphamide, then you might think that cyclophosphamide is a chemotherapy drug. And another tip is look at the prefix and the suffix of the medication name and try to learn commonalities in medication names that belong to a particular classification. And this will help in answering a question. If you know a medication name in a test question and are unfamiliar with the med, if you can at least associate the med with a classification, you will be able to determine the med's side effects, its action, and the nursing interventions. So look at the letters in the med name and look for those letters that identify a particular med classification. Some examples are like the ACE inhibitors. Most medication names end with the letters PRIL. Your antiviral meds will contain the letters VIR in their names. So that's important to remember. And as we mentioned through the presentation, your beta blockers, they'll end with LOL. And your corticosteroids will end with SONE. We saw sulfonamides also. They'll always contain the letters SULF in their names. And your thyroid meds, they'll contain THY in their names, such as levothyroxine. And again, the bronchodilators, that's another example. Most medication names end with the letters LINE, such as theophylline. And again, back to the pharmacology chapter in the strategies book, there's a huge list of all of these classifications and how to remember them or recall them. So hopefully that helps you.
Awesome. So the next question says, pharmacology really scares me. There are just so many medications and I'm not sure where to start or how to approach this. Do you have any tips?
Sure. So some recommendations that we have include approaching your studying and reviewing by using medication classifications. So just as Linda was mentioning, those various medications, if you can determine what medication or what classification a medication belongs to, that's really going to help you. The reason we recommend this is because medications that belong to a particular classification have similar medication actions. They usually have commonalities in their side effects and also their nursing interventions related to administration or monitoring. It really is nearly impossible to learn every feature about individual medications. That would be an unrealistic expectation. And so learning medications by a classification system method, so to speak, will help you to group a lot of medications with similar properties together. And then it will make the amount of information that you need to learn become much less and therefore much more manageable. And so, for example, group all of your beta blockers together and remember that most of their names will end with LOL. And then if you group together the intended effects, which are going to all be similar, then you group the side effects and then the adverse effects and then the nursing interventions, including patient teaching. Patient teaching is a major aspect of nursing interventions. So like those questions that we went over about how to take the medication and when to take it, those are all considered patient teaching points. And again, all of these things will be similar. And so take this approach with all of the common classifications. Don't try to memorize every side effect and every adverse effect, every nursing intervention for all of the medications that you think you need to know. It's best if you associate side and adverse effects with nursing intervention. So for example, if a side effect is hypertension, then an associated nursing intervention would be to monitor the blood pressure. If a side effect is hypokalemia, then an associated nursing intervention would be to monitor for the signs and symptoms of hypokalemia, to monitor their potassium level. And then, so this approach, which we like to call SMART study approach, it's one of our SMART study approaches, makes the vast amount of information that you need to know for pharmacology much more manageable.
Awesome. Want to make sure, I know we're at time, but we have 3 or 4 more questions I think we can still get to that will certainly help students as they're preparing. So this next question, person writes, there are 2 quick things I want to be sure of. You mentioned all medications will be presented as generic names, correct? And also, how many questions will the NCLEX show that is pharmacology?
Okay, do you want me to answer the first part about the generic names? Well,
Sure.
yes. Okay, you will see primarily generic names for all of the medication questions that are on the examination on NCLEX. So that's why we highly encourage you as you're studying while you're in nursing school or preparing for the NCLEX to learn those generic names. So this won't be so difficult for you on the NCLEX. Now you may see 1 or 2 questions that will use a trade name. Otherwise, prepare for the exam knowing that questions will present generic names.
Yes, and then as far as pharmacology, with how many questions will be pharmacology ones on the NCLEX RN test plan dedicates 12 to 18% of questions on pharmacology and intravenous therapies. And then on the PN exam, it's 10 to 16%. So what this means is that if you took a 100 question exam for the NCLEX RN, 12 to 18 of those questions would be pharmacology, and then for the PN, it would be 10 to 16 questions. So you can see that it is a very important area to focus your studies on because you do get a good number of questions in this area.
Awesome. This next one asked what the main differences are between the 7th edition comprehensive review and the 8th edition that you showed the resources for tonight.
Okay, well, we can both respond to that, Angela. Did you want to start, or I can start if you'd like, and then you can
Sure, you can
fill in?
go ahead. Yeah,
Okay,
go
well,
ahead.
first of all of the medications are updated, and we have the current 100 top prescribed medications listed in the back of the book. So that's one thing. So you've got updated content, updated list of pharmacology questions. Every question in the entire book, and there's over 6,000, have been reviewed by reviewers, changed, revised, updated, whatever they might need. We have added a complex care chapter to the books, so that's very important, and it addresses all of the points that are identified in the NCLEX examination with regard to management of care and emergency situations. So we have added that. And we've also added some clinical judgment types of next generation NCLEX questions and we know that if you're graduating soon or you're graduated this year, you won't be seeing those types on your exam, but they do strengthen your clinical judgment skills. Okay, Angela, you want to jump in and add?
Yeah, specific to pharmacology, one thing that we thought was very important was to have a pharmacist review all of our pharmacology content. And so Linda mentioned that we have reviewers, and I just wanted to mention that a pharmacist is actually one of the reviewers that we have looked at this content specifically. And I think that's very important because of how rapidly medications are changing on the market. And so we feel that it's very updated in terms of having medications included that are still being used. And in addition to that, the 8th edition allows you to pull the questions based on medication classification, like I had demonstrated to you just now, as well as health problems. And so you'll be able to go into the respective body system. So if you have an exam coming up on endocrine and it's focusing on diabetes and thyroid, you'll be able to pull questions specific to thyroid conditions and specific to diabetes rather than all endocrine problems. So those were added features. We felt that it was really important to help those of you that are studying for your nursing exams that aren't taking a comprehensive exam per se, to be able to still meaningfully use this resource.
Awesome. Thanks for explaining the differences between the Saunders Comprehensive Review Book of the 7th and 8th edition there. We do have time for a couple more questions. So you had noted about avoiding alcohol on the NCLEX. Is there a difference between limiting versus avoiding alcohol? And does that also include wine?
Do you want me to take that, or would you like to, Angela?
I don't mind starting with that one.
Okay.
So if there's an option that says to limit it to a certain number of alcoholic beverages per day, that's not an option that you would ever want to choose. When we say avoid choosing an option that pertains to alcohol, that means that if it's an option that states taking any amount of alcohol, that would be an incorrect option. So avoid means to essentially abstain entirely as it pertains to medications. And yes, it would include wine. Anything that has any kind of alcohol content would be considered to be something that should be avoided. Linda, do you have anything to add to that?
No, except just one thing, read your question carefully, and your question, may indicate or may say, and it would be clear, that the prescriber has said it was okay to have 1 beer a day, 1 shot a day, or whatever. And so if the prescriber said it was okay, then it would be. But otherwise, no alcohol, no smoking on the NCLEX exam.
Yeah, that's a great point.
Yeah.
Awesome. So this student kind of goes along with the alcohol question. They wondered, is milk also another option that might not be chosen for administering meds due to issues with dairy interactions?
Okay, well, the question, you'd have to read the question again and go back to the question, and it would have to indicate that the client was lactose intolerant or relate to something that had to do with a dairy problem. Generally, we look at milk as similar to an antacid. And it's not always good to select milk as an option to administer with meds. There are some meds that it's absolutely fine to do with, but generally, if you have to make an educated guess on a farm question, we would advise staying away from selecting milk as an answer. Anything to add, Angela?
Yes, I think those are all excellent points. I agree with everything you said, Linda. And I would just add that because of, if you think about the different processes involved with pharmacokinetics, absorption being the initial step, anything that's in the stomach can inhibit absorption. And then the other important principle associated with that is that a lot of medications require some level of gastric acidity in order to break down the medication and for it to then be usable. And so milk is one of those things, as kind of a general principle, that would be avoided with concurrent administration of the medication. It's not to say that they couldn't ever drink milk, it's just we wouldn't necessarily usually recommend them to take the medication with milk because of those inhibitory effects that it has on the absorption of the medication because of the breakdown issue. And so general rule would be to avoid concurrent administration with milk.
Excellent points, Angela. Thank you.
Thank you. Sure.
So I know that we're a little bit over. I'm going to just ask 2 more questions before we wrap up. This next one states, are select all that apply questions all or nothing, or are they awarded partial credit on the NCLEX?
Okay, well, currently on the current NCLEX examination, it's all or none. There is no partial credit given for incorrect answers or whatever. It has to be right on. It's exactly as it says, select all that apply. So currently you have to be selecting all of the correct ones. And it just has to be a perfect answer. In the future, that may change when we start with the next generation NCLEX. So for those of you who aren't graduating for a while, those select all that apply may be different, but right now it has to be exactly correct.
Yeah, and the only thing that I might add to that would be it's probably the case that many of your instructors during your nursing program will allow for partial credit on those, but I encourage you to take a really close look at that as you're progressing through your program and kind of see how you're doing with those and gauge that. Because as Linda mentioned, right now you do not get partial credit. You have to have all of the correct ones correct, and you cannot select any of the incorrect. And so pay close attention to that. And you do have the ability in the Evolve resources for many of our products to filter questions based on alternate item formats, and multiple response is one of them. And so even just by practicing those, it will really, really help you to do well with those, and using kind of the true, false, or the yes or no approach with those. As you're reading each option, you say, yes, this is correct, no, this is incorrect, and kind of just reading them exclusively of one of another is a good way to answer those questions.
And one other quick point about that is that for the select all that apply, so for example, if there are 6 options or 7 options, 1 could be correct, only 1, or all 6 or all 7, whatever it is for the number of options. So it may be that only 1 of those options are correct out of the whole list of them. So that's just one other point to make.
Yeah, and we don't always say this to our students, But the select all that apply, just kind of by nature, address a higher level of cognitive ability. And so they tend to be the more difficult questions. And so we do like to say, don't get too nervous if you're seeing them, because they're difficult questions, which is always a good sign.
Great. All right. So one more question. Can we assume dosages listed are correct when taking the NCLEX?
Yes, you can.
Yeah.
They're not asking about, you know, what you would give for a dose. But, you know, and Angela, you can jump in at any point on this one. Usually what they give you in the question is correct, unless the question is stating something about the need to contact the prescriber. And Angela, do you want to add to that?
Yeah. So what I would say is that because you're not a prescriber, it's not going to, the dosages are not going to be a major focus. And so if a dosage is provided, the way that the NCLEX is set up at this point is that if there's any information that's provided, then it's going to be pertinent to the way that you're answering the question. And so if a dosage is provided, it's possible that they may be testing you on a concept related to the dose. And I would anticipate that you would most likely see a question like that focused on pediatric content, because safe dose administration is an important concept for that population. Other than that, I would be kind of surprised if they were testing that for like an adult or something like that, because as I said, it's not something that you are prescribing. And so if anything, as Linda mentioned, it would just be dosage clarification that you may be asked about. And so if it is there, if the dose is specified, I would pay attention to it and think to yourself, are they asking me about this being a safe dose?
Awesome.
Yes, and just one other point with regard to that is that if they are expecting you to know about the dose, it would be a very common medication, one that you give frequently, perhaps digoxin, and the dosage would be quite obvious that it's not a normal dose.
Right. Absolutely.
Yeah.
I would be, in general, I would be kind of surprised, honestly.
Yeah.
Because there's so many, you know, that would be a lot to know. But to err on the side of caution, I would say if it's there, just pay attention to it, but it should be obvious, like Linda's saying.
And we don't want you to be preparing for the NCLEX by trying to study dosages, normal dosages. Just don't do that at all.
Right.
For this examination.
Awesome. Well, that concludes tonight's session. It seems we got a lot of great comments and feedback from students saying tonight was helpful. We encourage anyone who is still on to also join us next Tuesday as we have a special Q&A with Linda and Angela again, and 2 students who recently passed their NCLEX exam. Thanks everyone and have a great night.
Thank you.
Thank you.